Good afternoon. Welcome to the Real Talk page. I'm going to leave some information in the comment section. But yes, please feel to put any comments, questions, or concerns down there in the comment section. And we'll get started. Again, good afternoon. My name is Ayele. I'm the Community Health Education and Training Coordinator here at Whitman-Walker Health. And this week's Real Talk Live is about seasonal affective disorder. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STI, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. Again, my name is Ayele. My pronouns are she, her, hers, and I'm the Community Health Education and Training Coordinator here at Whitman-Walker Health. So today we're talking about seasonal affective disorder. What is seasonal affective disorder? It's something that affects many people. Many people go through short periods of time where they feel sad or not like their usual selves. And sometimes these mood changes begin and end when the seasons change. Some people may start to feel down when the days get shorter in the fall and the winter, also called the winter blues, and begin to feel better in the spring with the longer daylight hours. In some cases, these mood changes can be more serious and can affect how somebody feels, thinks, and handles just daily activities. If you've noticed significant changes in your mood and behavior, whenever the seasons change, you may be suffering from seasonal affective disorder, or SAD, which is a type of depression. In most cases, SAD symptoms start in the late fall or early winter and go away during the spring and summer. This is known as winter pattern SAD or winter depression. Some people may experience depressive episodes during the spring and summer months, and this is called summer pattern SAD or summer depression, and is a bit less common. Some signs of it is because SAD or seasonal affective disorder is common, especially with those with experiencing other mental health conditions. It is not always considered a separate disorder, but a type of depression characterized by its recurrent and seasonal patterns with symptoms lasting 4 to 5 months per year. Therefore, the signs and symptoms of SAD include those associated with major depression and some specific symptoms that differ from weather and summer pattern SAD. Not every person with SAD will experience all of the symptoms that are associated with it, but some of them can include feeling depressed most of the day, almost every day, losing interest in activities you've once enjoyed, experiencing changes in appetite or weight, having problems with sleep, including feeling sluggish or agitated, having low energy, feeling hopeless or worthless, or having difficulty concentrating, having frequent thoughts of death or suicide. And for winter SAD specifically, there can be some specific symptoms, including oversleeping or hypersomnia, overeating, especially with craving carbohydrates, weight gain, social withdrawal, and you refer to it as hibernating, or specific symptoms for summer SAD can include trouble sleeping as well, but less sleeping, so hyposomnia or insomnia, and poor appetite leading to weight loss, restlessness and agitation, anxiety, episodes of violent behavior, and many people often notice that in the city, things tend to get a bit more active or violent during the summer. This could be one of the reasons why. But if you or anyone you know is experiencing any of these symptoms or in immediate distress or thinking about harming themselves, please always refer to the National Suicide Prevention Hotline, toll free at 1-800-237-TALK, which is 1-800-237-8255. There's also a text crisis line at just text by texting hello to 741-741. And there's also a Lifeline chat on the National Suicide Prevention Lifeline website. So back to seasonal affective disorder a bit. If you think you may be suffering from it, talk to your healthcare provider or your mental health or a mental health specialist about your concerns. They may have you fill out specific questionnaires to determine if your symptoms meet the criteria for seasonal affective disorder. And to be diagnosed with seasonal affective disorder, there is some criteria that they're looking for to meet. And that criteria is to have had symptoms of major depression or of the more specific symptoms that we had discussed earlier. And these episodes must occur during specific seasons, like only during the winter months or only during the summer months, for at least 2 consecutive years. However, not all people with seasonal affective disorder do experience symptoms every year. The episodes must be much more frequent than other depressive episodes that the person must have at other times or at other parts of the year during their lifetime. Millions of American adults suffer from seasonal affective disorder, although many may not even know that they have the condition. It occurs much more in women than men, and is more common in those living further north, where there are shorter daylight hours in the winter. For example, people living in Alaska or New England may be more likely to develop seasonal affective disorder than those living in Florida. In most cases, seasonal affective disorder develops in young adulthood. It is more common in people who are experiencing major depressive disorder or bipolar disorder, especially bipolar 2, which is associated with recurrent depressive and hypomanic episodes. Less severe than the full-blown manic episodes typical of bipolar 1. Additionally, people with seasonal affective disorder tend to have other mental disorders, such as attention deficit or hyperactivity disorder, an eating disorder, anxiety disorder, or panic disorder. And SAD or seasonal affective disorder sometimes runs in families. It's more common in people who have relatives with other mental illnesses as well, such as major depression and schizophrenia. Scientists do not fully understand what causes seasonal affective disorder, but research indicates that people with seasonal affective disorder may have reduced activity of the brain chemical serotonin, which helps to regulate mood. Research also suggests that sunlight controls the levels of molecules that help maintain those serotonin levels. But in people with SAD, this regulation does not function properly, resulting in a decreased serotonin level in the winter. Other findings suggest that people with seasonal affective disorder produce too much melatonin, the hormone that is essential for maintaining the normal sleep-wake cycle. Overproduction of melatonin can increase sleepiness. Both serotonin and melatonin help to maintain the body's daily rhythm that is tied to the seasonal night-day cycle. In people with seasonal affective disorder, the changes in serotonin and melatonin levels disrupt the normal daily rhythms. As a result, they can no longer adjust to the seasonal changes in daylight, leading to sleep, mood, and behavior changes. Deficits in vitamin D may exacerbate these problems because vitamin D is believed to promote serotonin activity. In addition to vitamin D consumed with diet, the body produces vitamin D when exposed to sunlight on the skin. With less daylight in the winter and it being less comfortable to be outside, people with seasonal affective disorder may have lower vitamin D levels, which may further hinder serotonin activity. Negative thoughts about winter and its associated limitations and stresses are common amongst people with SAD and others, and it is unclear whether these are causes or effects of the mood disorder, but they can be a useful focus of treatment. And speaking of treatments, there are many treatments that are available to help those suffering from SAD, and they fall into 4 main categories that may be used alone or in combination. One being light therapy, another being antidepressant medications, another being vitamin D. Light therapy, psychotherapy, antidepressant medications, and vitamin D. And always refer to your healthcare provider to see what may be recommended for you or treatment plans. But we can go into a bit about what each of these look like. For light therapy specifically, light therapy has been a mainstay for the treatment of SAD. They aim to expose people with SAD to a bright light every day to make up for the lower levels of sunshine in the darker months. For this treatment, someone sits in front of a large light box, usually, that's a very bright light, every day for 30 to 45 minutes, usually first thing in the morning from fall to spring. The light boxes, which are about 20 times brighter than ordinary indoor lights, filter out potentially damaging UV lights, making it a safe treatment for most. However, people with certain eye diseases and people taking certain medications that increase sensitivity to sunlight may need to use alternate treatments to use light treatment under medical supervision. Another type of treatment is psychotherapy or talk therapy. It is cognitive behavioral therapy, or CBT, and it is a type of talk therapy aimed at helping people learn how to cope with difficult situations. CBT has also been adapted for people with SAD, and it is typically conducted in 2 weekly group sessions for 6 weeks and focuses on replacing negative thoughts related to the winter season, about darkness of winter, with more positive thoughts. You get to play in the snow. But whichever works best for them. CBT, SAD, or cognitive behavioral therapy for seasonal affective disorder, also uses a process called behavioral activation, which helps individuals identify and schedule pleasant, engaging indoor or outdoor activities to combat the loss of interest that is typically experienced during the winter. When researchers directly compared CBT with light therapy, both treatments were equally as effective in improving SAD symptoms. Some symptoms seem to get better with light therapy than with CBT. However, long-term studies found that SAD patients for 2 winters found positive effects of CBT lasted longer than the effects of light therapy. There are also medication treatments that are available, and because SAD, like other types of depression, can be associated with disturbances in serotonin activity, antidepressant medications called selective serotonin reuptake inhibitors, or SSRIs, can be used to treat seasonal affective disorders when symptoms occur. These agents significantly enhance patients' mood, and commonly used ones are citalopram, sertraline, paroxetine, and fluoxetine. The U.S. Food and Drug Administration, the FDA, has also approved another type of antidepressant, bupropion, in an extended release form that can prevent the recurrence of seasonal major depressive episodes when taken daily from the fall until the early spring. But with those being said, all medications have side effects. Talk to your doctor about the possible risk of using these medications for your condition. You may need to try several different types of antidepressant medications before finding one that improves your symptoms without causing problematic side effects. For basic information about those, again, please feel free to speak with your medical professional, your mental health provider. There also is more usually up-to-date information on the FDA website, updated information on the medication, side effects, and warnings for each one. Next treatment is vitamin D. Because many people with seasonal affective disorder have a vitamin D deficiency, nutritional supplements of vitamin D may help improve those symptoms. However, studies testing whether vitamin D is effective in seasonal affective disorder treatment have produced mixed findings, with some results indicating that it is as effective as light therapy, but others detecting no effect. And the most important thing to talk about is prevention. We always like an ounce of prevention is worth of a pound of treatment. So again, because the timing of the onset of winter pattern SAD is predictable, people with a history of SAD might benefit from starting treatments mentioned above before the fall to help prevent or reduce the depression. To date, very few studies have investigated this question, and existing studies have found no convincing evidence that starting light therapy or psychotherapy ahead of time could prevent the onset of depression. only preventative treatment with the antidepressant bupropion prevented SAD in study participants, but they also had a higher risk of side effects. Therefore, people with SAD or seasonal affective disorder should discuss all their options with their healthcare providers if they want to initiate treatment early to prevent depressive episodes. Please feel free to leave any questions in the comment section. But again, thank you so much for tuning in to learn more about seasonal affective disorder. Before we go, I wanted to give you a few reminders about COVID-19 and the various viruses we're fighting as a community. If you've already gotten vaccinated, congratulations. You've taken a very important step to preventing yourself, your loved ones, and your communities from illness. Multiple variants have soared around the world, and it is understandable why you would want to keep wearing your mask. The vaccine isn't 100% effective, and more contagious variants are spreading, and there are very few protocols in place to actually verify if the folks around you have been vaccinated or if they're sick. So keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccine available. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us, DC residents can find information on the COVID-19 vaccine walk-up locations at vaccinate.dc.gov or by calling 1-855-363-0333. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccine appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you consider getting the vaccines, discussing COVID precautionary measures with those around you, and to be mindful of masks and to keep your distance, but especially if you don't know if someone has been vaccinated or not. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and checking out our website, whitman-walker.org, for the most up-to-date information on our services. For more COVID-19 resources and general Whitman-Walker services, please call us at 202-797-4439. Follow some of our programs in Whitman-Walker family at this page, Real Talk DC, and at No Filter DC, and our main page at Whitman-Walker Health. Thank you so much for tuning in with us today again. And again, my name is Ayala. I'm the Community Health Education and Training Coordinator here at Whitman-Walker Health. And thank you so much for tuning in. Have a wonderful evening and take care.